Well, thank you, Mr. Chairman, and thank you to all our witnesses for being here today and welcoming us to your community. When I go home to Kansas nearly every week to contact with constituents, it's always nice to have the opportunity to take our work outside the D.C. bubble and to hear directly from folks impacted by our policy decisions and how they impact them in their daily lives in their own home communities. And what brings us here to Lone Star State today is a critical issue. It affects Kansans, it affects Texans, it affects Americans all over. And we'd all like to think that we'll escape emergency medicals. They happen to other people. But when the unimaginable happen, knowing we can count on responsive and reliable emergency medical care brings us some comfort. A key means of delivering this care, as we talked about earlier, especially in rural communities, is through air ambulance services. The 4th District of Kansas that I represent includes many rural communities which rely on these emergency air services. A study released last spring found that 77% of urban counties and 84% of rural counties have ambulance deserts, locations that can take more than 25 minutes to be reached by ambulance. And in rural areas, after dialing 911, patients can still wait up to 30 minutes for an ambulance to arrive, or even longer. Given the state of air ambulance service can be the difference between life and death. A 2019 study found that injured patients transported by air ambulance were less likely to die than those taken by ground ambulance. That's why last spring I worked with my Ways and Means colleague, Ms. Delbeni, along with Senators Michael Bennett and Marsha Blackburn, to introduce legislation to improve access to the emergency air medical services that are critical for saving lives, particularly those of Americans that live in rural communities. The Protecting Air Ambulances Services for Americans Act would use data collected from the No Surprises Act to update Medicare reimbursement rates for emergency air services. This common sense bipartisan bill will ensure all Americans have efficient access to hospitals and specialty providers regardless of their location. When seconds matter, air ambulances are proven to be the best way to care for patients in need, as those of you that work here at Global Medical Response know. Dr. Rock, in 2002, CMS established the first air ambulance fee schedule. Can you share what improvements and equipment changes you've had since 2002?
Thanks. I didn't realize the hearing was going to last until tomorrow. Substantial. And I think what you've seen, hopefully today, in terms of the technology, in terms of the skill level of our providers, being able to resuscitate, intervene, decision support tools that identify patients that may be at risk for a myocardial infarction, blood carrying capabilities, the ability to stabilize patients in ways that we never, ever would have imagined before. And I think it raises an important point, which is there are two sides to the air ambulance that are critical for patients' morbidity and mortality. The first is we have to get to them, wherever they are, with the tools and the expertise of our providers to stabilize that illness or injury immediately. Because one of the things, as I talked about in the beginning, we have a logistics problem. Nowhere else in medicine do we have this strange problem of saying you have this injury or this illness, but look how far you are, or look where you are in relation to definitive care. So the technology has evolved. It allows us to stabilize. We can communicate a lot of that technology to healthcare facilities and professionals and maximize our ability to make a difference. It's huge.
Yeah. And what risk are you have of the bases being in danger of closing just from not having reliable reimbursement and fee changes that reimbursement rates that have not changed?
It's very worrisome, and it's worrisome in exactly the environment that you're in and described, which is if we can't sustain the technology, the education, the equipment, if we're unable to do that, we essentially have an aircraft that's not moving patients that frequently which can no longer support the ability to stay in that community. So if you were to ask, I think, our colleagues, whether it's hospital, air ambulance, we are fearful that without the support of that cost of readiness, we will have to move bases, we will have to close bases, and as we've already heard, unfortunately, close hospitals.
Well, thank you. And I 5 minutes just isn't enough time to go through all these questions that I have, and the services that y'all provide for our citizens of our country is so important. So I'll yield back, Mr. Chairman.